On This is Manitoba, we continue to dig through the story of what happened to a man who died on January 7th in Winnipeg's HSC ER, so the Health Sciences Centre Emergency Department. I'm Marcy Marcusa. In 20 minutes or less, we've had time to walk through a lot of details so far, but today we're going to hear from the family. So while she still has a lot of questions, she says, about how her brother died, waiting for care on January 7th, Ronalee Reynolds says her family finally has closure. So we're going to begin there. And we also know the man's name. His name is Chad Giffin, and he did die after waiting 8 hours to be seen in the ER in Winnipeg at the HSC. So she, the sister, was notified several days after he died, and she has given us some details that advance the story. So her brother, Giffin, was under the care of the public trustee and told HSC that he had no next of kin. As you may have been hearing or reading, Reynolds believes that if the hospital had contacted the trustee, they may have tried to reach her mother, but if they'd done that, the phone numbers are no longer in service. So updating contact information in the system is just one of the things that she hopes might be improved in the wake of her brother's death. CBC's Erin Brohman spoke to Reynolds about the entire experience.
Until we actually heard from them, it was still somewhat unknown. We knew, but we didn't officially know. So it's a lot of relief on our behalf. And we are grateful, so grateful that they've been in touch. They did answer our initial questions as best they could. And I feel confident that they're going to keep us informed as new information comes to light, that they are going to do everything that they can to help my mom and I get through this. And things that people might not think are important, they might be important to my mom and I. And I do feel confident that they're going to keep us informed in even stuff like that they don't think most people would find important. And I'm really looking forward to keeping that communication door open and getting through this together, all of us. It's not going to be quick. It's not going to be painless, but it's going to help all of us, even though it's going to be long and drawn out. But I think it's going to help everybody. They told me that a concerned citizen had called 911 because he was outside downtown Winnipeg and it was very, very cold on Monday night, and they had called 911, and I guess an ambulance went to kind of check him out, and I guess there was conversations, and a decision was made that he would go to the hospital. I don't know much more than that. I know that when he got there, his vitals were good enough, I guess, and that is why he went to the waiting room. He had a lot of underlying health issues as well. I don't know if his death was related to anything about his actual medical history or if something had happened that night or day or morning, I guess. But that's all going to come to light during this investigation, and we're looking forward to some of those answers as well.
You had questions about his time in the ER and whether he was being checked on. Did he have anything to say about that?
He said they didn't know yet, and that was more or less, I think, going to be one of the first things that they look into is how often were they checked in on, and not just Chad, but like everybody. I mean, obviously Chad is going to be the priority, but how often did anybody go around and be like, how are you doing? How are you feeling? Are you still okay? Or anything like that. That is definitely going to be one of their first things that they were going to look into.
What do you hope now comes from this?
Honestly, right now, where Mom and I are, we kind of just hope that some policies might change on how to communicate with families or how to locate families, because it seems like they didn't think about how the last time the public trustee had our information, how long ago was that? Well, times have changed. We don't have landlines anymore. We didn't have social media. There's a lot of different ways that people can be located, and hopefully they Well, I feel confident that they're going to learn, that they have learned that, geez, we can't just take what's been on file. There's other ways that we can try and find people, because there's no need now for families not being notified of stuff just because they didn't think that they had family. Like if there was a kind of facility where people with no fixed address and some mental health disorders, if there was a place for them to go. And then when there's a situation like this, okay, so there's 100 people in the waiting room at the ER, that's a drain on the system, and that's not fair. There could be somewhere else. There should be somewhere else that they should be. And if Chad was in that situation where there's somewhere else he should have been, it's unfortunate that that facility is not available. We've got closure now. We aren't worried. We aren't wondering, because honestly, over the last almost decade, that's all it's been, is like, gee, I wonder where he is. I wonder if he's okay. I wonder if he's even in Manitoba. Like, we didn't know where he was. We didn't know if he was getting any help. We had so many unanswered questions. We kind of made an assumption that it's very likely that something had happened, and we didn't know. It's really nice to have that closure. We know that he was in Manitoba. We know that he was somewhat getting help. He wasn't obviously living the life that we would have ever wanted for ourselves or for anybody. That would be so very difficult. It's very nice now knowing that he's at rest and he's not suffering and that he's okay now.
That was the CBC's Erin Brohman in conversation with Ronalee Reynolds. She's the sister of Chad Giffin, who died waiting for care at HSC in the emergency department on January 7th. Well, next on the podcast, could technology have helped in terms of what is going on in the waiting room and helping patients who may be in distress? We're going to take you next to a 6-month pilot project that has just wrapped up on the East Coast. This is in Nova Scotia. They wanted to address things like wait room protocols, wait time, and patient monitoring there. So they put in this pilot project to help curb these issues at Dartmouth General Hospital. And they've had a lot of success with what they did with the tech. There's plans to expand it to hospitals across that province. So what is this technology? Rachel Nalepa is the Interim Health Services Director for Dartmouth General. Good morning.
Good morning, Marcy. How are you?
I'm well. So just as a baseline, what led you to look at implementing this pilot in the first place where you live?
Yeah, it's a good question. Well, emergency departments all over the world are really facing these very large volumes of patients coming in that has really been exacerbated post-COVID. And what the team here in Dartmouth was finding is that we just were not satisfied with the wait times in the waiting rooms and the fact that patients were sitting in the waiting rooms unmonitored while waiting to see a physician or a nurse practitioner within our main department. And so we thought that this was a good way to help increase the safety and the satisfaction for the patients while they're in the waiting room, just to make sure that nothing untoward happens to them.
And so what's the tech that you're using and how does it work?
Yeah, so the tech is an actual wearable vital sign monitor. So it's a very small piece of equipment that's attached to the patient's hand and wrist. And then via Bluetooth, it actually transfers information to a monitor where a registered healthcare professional can watch it. So they can watch their heart rate, their breathing rate. You can choose options to watch their blood pressure as well as the amount of oxygen that's in their blood.
Who gets the monitor put on them? Is it every patient, or how are those decisions made?
No, it's not every patient. So we do have criteria based on literature of what type of a patient would benefit from this type of a monitor. So it would really depend on the vital signs and the condition that the triage nurse finds when the patient first comes in. And then, of course, we've also left it up to the nurse at triage, where if they feel something in their gut, like this patient needs a wearable, they will just put a wearable on them before they go to the waiting room.
And who looks at the information that's coming in? Is it the is it the nurses or healthcare professionals at the triage desk that are monitoring that information, or is that a separate person that's actually focused and watching that?
Exactly. It's a separate person, Marcy. So part of the challenge with these very busy waiting rooms is our triage nurses were unable to keep their eyes on everyone while also triaging new patients that were coming in the door. And so before we started the wearable pilot, we actually did another pilot where we implemented what's called a waiting room care provider. And that's also a licensed staff member. So either a registered nurse, licensed practical nurse, or advanced care paramedic, whose sole job for their shift is to care for the patients in the waiting room. And so this waiting room care provider, or WRCP, is who monitors the information from these wearable devices, and then they can intervene if they need to.
So that's obviously that's directly important for us in Manitoba, because after the death of Brian Sinclair some years ago, there were policies instituted, and we have had people checking. This was one of the things that changed in HSC's waiting room, that there are people, human beings, that would check on folks. And you guys had that and you moved to the tech. Well, what's the difference been then? What success have you seen with the tech?
So we've been able to catch patients whose vital signs are actually changing in the waiting room that otherwise we would not have noticed. So we've been able to catch patients whose heart rates have jumped up drastically high and brought them in to be seen immediately. And there's also been a number of patients we have caught whose oxygen saturation levels are dropping, potentially because of a respiratory illness. And so we are able to then re-triage patients with more information than we had at the initial assessment. So overall, it has been incredibly successful.
What's the reaction been from those, human monitors, for lack of a better term? I've forgotten the term you used, that would have been in the ER checking on patients, and now they're the ones looking at the data. What's the reaction been from them?
So we did do pre-surveys from the staff and post-surveys. It's a 100% satisfaction from the team. The team was really the ones that felt like they couldn't provide the best care that they wanted to these patients in our waiting rooms. And so they adopted it very well. They're very pleased with it.
Obviously, you have plans to expand it. I alluded to that. Can you tell me sort of about why? You've already talked about the success, but what was key in saying, no, this is worth expanding, and here are the data points about why?
Yeah, so, we gathered both, quantitative data, so the numbers of wearables that we were using to try to capture the number of patients that actually need this technology in the waiting room. And sometimes it's upwards of 16 patients in a 12-hour shift that actually get a wearable. The other thing that was really important to us was the patient feedback. So we also did a pre-survey with patients in our waiting rooms and then a post-survey with patients in our waiting rooms, and 100% of them felt more comfortable in our waiting room while they had a monitor on. And so that was very important to us. Of course, we want to avoid any adverse event, but we also really want to make our patients feel comfortable and like they're being cared for while they're waiting.
Were there any challenges that you didn't expect in changing your system?
I think that, it's really with any change, you're going to go through that change process. There might be a little bit of a grieving process. And, not to say that there was no challenges, but honestly, I've been in a lot of projects and this one was relatively easily adopted. I think aside from anything else, we're adding something new onto staff who already have a really large workload. But the bottom line is that we were able to really prove the benefit of it.
Anything to add that I haven't asked you about?
I don't think so. I mean, we're so pleased, and I will talk about this project all day long because I think it was really beneficial for our group. I think it's certainly worth others looking at. Technology is not the silver bullet. It's not going to fix everything. It might not even work in some areas. But I think that if it's something that a department feels like could be beneficial, I really urge them just to look into it a little bit and see if it might help.
I suppose I should have asked, especially with upcoming budgets this spring, in March, what the cost was to do this.
Well, we were very fortunate that our foundation was able to find a community partner that actually funded it for us. So fortunately for us, that was not a barrier.
Do you know what the cost was, though, that was covered?
Not off the top of my head, but if you're looking operationally, it's going to be six figures.
Yeah. Thank you very much for taking us inside your changes in your province. Much for us to think about here. Appreciate it.
You're very welcome. Have a great day.
You as well. Rachel Nalepa is the Interim Health Services Director for Dartmouth General Hospital. Well, This is Manitoba for today. Thanks for tuning in. Don't forget to like and share.